Hey, I'm calling to share my story about a time in Italy after I'd had a great dinner at a restaurant when I set up my business. I was there for some trade shows, and after a long day, I met up with some friends to have a nice meal. The chef comes out and talks about his dishes, and something sparked. The way he was so obsessively speaking about his supply chain, sourcing of everything down to the smallest, tiniest ingredients. It was that thoughtfulness and excitement behind every dish. But beyond that, it was the resourcefulness and creativity to use all parts of the ingredients that he was working with and truly see nothing go to waste. It was something I had never seen in the industry that I worked. My business is all about tying food and fashion together in innovative and sustainable ways. It was at that table that the blueprint for the business started to make sense. And we've continued to have big brainstorming sessions at tables, almost as a ritual now. And actually, a few days prior to this, my now husband had proposed to me at another table.
What'd you say? Heard. I got that, don't worry.
Okay.
Heard, chef, got 20 chicken all day.
There's a moment at the restaurant table where I always get this little jolt of energy. And it's not because I'm excited about the food. It's about this power of togetherness that I get, of sitting with friends or family, even strangers. The table is inspirational. It's where you share ideas, you form new relationships, and just like you heard there, start entirely new businesses. I'm Ryan King, and I believe that the table is the stage of life. And I've been lucky enough to spend a lot of time around that table because I've been writing about the restaurant industry for most of my career. And I've got to meet lots of chefs. And if there's one thing I've learned, it's that they love their job.
I get to play with knives. I get to see people's reactions. I get to cook food. Like, it's instantaneous gratification on everything.
I just love being alone in the kitchen sometimes, butchering, cooking octopus, smelling, making ragu, or just taking it slow.
It's such an art. I mean, people talk about that all the time, but I love the idea of like the immediate gratification of serving someone, the idea of service.
But despite the powerful feeling people get from that service, there is a major problem in the restaurant industry in the US.
Health insurance. If you have health insurance and you are okay to take a day off, then that means that the pay is not quite as brutal.
But there's a reason why so many restaurants don't offer this.
Will match or half the health insurance. But if I were to pay everybody's health insurance, my $95 or $105 menu would be closer to $175. I think most people would think that would be insane. Universal healthcare, there is no solution.
In almost every interview I've done for this series, the conversation inevitably hits the issue of healthcare, which is why I'm very excited to introduce someone who thinks that they may have found a solution to this very large problem.
So I'm Elizabeth Tilton. I'm based here in New Orleans, Louisiana, and I'm the founder and CEO of Oyster Sunday and OS Benefits. We're a consulting company that helps to own and operate restaurants. So we support with financial analytics, HR, operations, marketing, and branding.
You're going to hear how Elizabeth has somehow cracked a code that so far has seemed impossible to crack. This is Heard. Elizabeth's company helps with the business side of running a restaurant. And that's something that chefs I've been speaking to ask me about a lot. Because let's face it, who goes into a career in food thinking about all the spreadsheets that they're going to have to create? And Elizabeth, well, she's like this Venn diagram of food, business, and health.
I was pre-med at the University of Virginia and started a catering company my second year of college. So I'd be going to organic chemistry lab, coming home and cooking for corporate parties of 400. And so I had this kind of culinary theme that followed me through my life. But it wasn't until my fourth year where I decided to not pursue a career in pediatric oncology and instead to cook. Moved back home and started at Sucre. I was in the commissary kitchen, so I've always been in pastry. When we're talking about the crystallization of lattice structures of sugars. I was very excited. And my chef was like, "What did you study?" It's like, why does this make you so jazzed? So, but it was very fun learning about commissary, learning about scaling, how to manage a team, and just kind of my first foray into the culinary industry.
Elizabeth got her stripes and has worked in all stages of restaurants. She's done the casual, she's done the fine dining, she's done service, kitchen, and management, and she eventually hit a point where it was time to expand her experience even further.
When it came down to wanting to make the jump to New York City, I joined the team at Momofuku Sambar in the East Village and was a manager there and learned door to floor 20 days how to even run a point of sale system. Never had managed a front of house team in my life, never had touched a point of sale. Was on the floor for a couple months and then eventually moved to corporate.
It's quite something to meet someone who's so steeped in all aspects of running a restaurant. She's got that same creative passion I see in so many chefs. But Elizabeth also has this analytical side, and it's going to be incredibly useful for this industry.
To me, when I was looking at going to medical school, and then when I chose to cook instead, there's an anchor of service that's inherent in both. And I think for me, that was the biggest gift you can give is like that connection over a dinner table. But I think for me, what the pivot was why I chose to go to the business side is that I loved the pursuit of understanding P&Ls and the logistics and drive structures. There's this whole other side of me, the scientist in me that was like, how do I improve? How do I keep moving these systems along and build a company for resilience for the long run?
Elizabeth has taken all of these skills and passions and she's applied them to working out how to create affordable healthcare for hospitality. You're going to hear what she's done and how she's done it coming up. But first, I wanted to find out more about the current state of healthcare in the restaurant industry. And according to Elizabeth, the lack of health insurance from employers has some dire consequences for restaurants.
So we talk about access to care is one of the biggest gateways in to employment. That is the barrier of entry into hospitality. So I would say that to me as an industry is really, really, really crucial. And I think that employers are going to be more pressed than ever to really think about health insurance and to really be mindful of really protecting their teams. And that requirement's going to be more and more palpable, particularly as Gen Z steps up the expectations of employment and what that means.
So let's talk about the history of healthcare in the US and how it got to this point.
In general, in the US, since the pretty much post World Wars, the responsibility of healthcare became on the private sector. Small businesses used it as a benefits incentive to recruit and retain talent since the 50s. And it's very interesting that it became kind of established then and then has swung so far the pendulum towards privatized healthcare. Obviously, we'll get into the ACA, the Affordable Care Act that was established in 2012. But I would say if we're talking about small independent restaurant businesses, that is probably the main focus of this podcast is what we're coming against in small business in the United States is that the onus is on the small business operator to find healthcare. They secure healthcare through a broker or through whatever it may be. They find healthcare, they get a quote, and the quote, having such a small team, usually under right around or under 50 full-time equivalents, the premium's very high. Their bottom line is tight. They don't have this really ability to contribute enough to get participation high enough for their team, right? The more you contribute, the less it costs out of the paycheck when people are trying to balance, do I pay my rent? Do I pay my health care? Which I think was particularly laid out to bear during COVID as we were frontline workers. And participation's low. Then you go 1 year after enrollment begins, you get audited by your insurance carrier because those likely on your plan are those who need it most, right? Maybe they have chronic conditions, whatever the occasion or the circumstance may be, they join the healthcare plan, they utilize it most, you get audited. Your participation's low, your utilization's high, your premium goes up and the cycle begins. And so it's leaving a lot of people very vulnerable. So what we see is you're seeing GoFundMe's on your Instagram account. You see people that are uninsured, that are looking for coverage of care when things go drastically wrong. And at that point, that's far too long. We're too far down the road at that point. So what the other options is that you have small business insurance and you have the ACA, the Affordable Care Act. individuals can go, their employer can give them, let's say, a stipend to go to the ACA and reimburse them for participation. But that requires your employee to go to the ACA, be unbelievably educated, sift through hundreds of plans to make sense of what's going to cover them. That's a really big undertaking for any individual, even myself, having learned a lot about healthcare in the last 3 years. And so those are kind of what's on the table. Otherwise, it's no coverage. And to put some stats to that, Ryan, there's between 11 and 12 million hospitality workers in the United States, and only 34% of workers have access to employer sponsored health insurance, well below the national average of the private sector, which is over 85%. So we have a huge gap. And then participation is in the teens. So we have around probably 9 million people that are walking around uninsured or have to go on their parents, have to go with their partners, have to go to the ACA. So it's a very big vulnerability, which is causing issues around recruitment and retention at this point in hospitality.
Chef?
Heard.
Heard.
You mentioned this idea of hiring and retention and how healthcare impacts that. And I think a lot of people don't make that connection. And there is a big issue. Post COVID, it's accelerated, as anyone who knows who works with restaurants, this idea of finding staff, retaining staff, keeping staff happy. Talk to me about the impact that no healthcare has on staff retention and staff hiring rates.
Yeah, it's something that we're definitely getting more information about over time. But I would say in general that in this post COVID world, when it comes to the expectation of employers and their employees, is that benefits, retention as part of recruitment is crucial. The expectation of the employee is that the employer is offering these as part of their incentive plans. To kind of dive into Oyster Sunday and OS benefits just slightly, because Oyster Sunday, we're a consulting company that helps to own and operate restaurants. So we support with financial analytics, HR, operations, marketing, and branding. And particularly in the financial analytics, we are constantly running models of what it means and the impact of adding benefits to your company, what it means for retention, how expensive is it to train and onboard. And a stat that kind of goes around, it takes about $5,000 to $7,000 to onboard someone. So every time you're turning, it's an immense expense to your company. And so what we're doing all the time is running these models and showing like what can you roll out of these tiers of benefits? What's really the economic impact on your business? And it's really fascinating to see that. And I think a lot of operators we're working with, they're saying, okay, well, if I want to contribute more benefits, then maybe we actually stay leaner. Maybe our teams are a little bit smaller, but we invest in them more. Maybe we take away a day of service in order not to increase our labor by 40%, or cut lunch or cut breakfast or whatever it may be. And so we help them run those models. So we're seeing that firsthand of the economic impact on these operators.
We're actually seeing a lot of weekend closures. I'm based in Europe.
Yeah.
One of the things that's happening a lot in Paris, which you would never expect it being such a touristy place, is closing Saturday and Sunday rather than the usual sort of Monday, Tuesday. And part of it is that retention of staff, but also being able to give staff time off with their family. Because if you're off Monday, Tuesday and your partner's off Saturday, Sunday, it creates this discrepancy that's really hard to find work-life balance.
Yeah. And I do think actually to that point, it's not necessarily like PTO is an enormous gift. Consistent schedule, pay time off. These are things that employers are also offering their teams right now. And sometimes they're even making decisions of not necessarily, maybe they're doing 5, 10, 15, 20 days of PTO, but they're also saying, what happens if we just close the entire restaurant down for a week and had a summer break or a winter break? Because they're actually learning that the cadence of the year mixed with holding food inventory, waste, when diners are coming in and just really trying to figure out what that right time frame is.
It must be fascinating to get all of these insights on how restaurants operate and that idea that it's 5,000 to bring a new staff member in. And then the real problem is you spend that money, you do that training, you expend all that energy. And if you're not offering them the benefits that make them happy, maybe they go somewhere else that is. So you've kind of paid all that money for nothing then as well.
Yeah. And then you also think about the cost of recruitment, interview processes, labor. Five is probably modest for some, depending on the role. and responsibilities of the employee. It's a really big deal. And I think the more on the oyster side, the more we see them, we've been really lucky to have helped over 200 operators coast to coast, and now internationally, help them with their business in different capacities. But we're really interdisciplinary. So we're looking at financial impact that impacts HR, that impacts operations, that impacts marketing and branding, because we can't do any of those really key functions in a silo. So we're really in the underbelly seeing the behaviors of restaurants and the foundation of them. And it's helping us gain insights of these trends or these opportunities for stability for our clients.
So you would actually put the HR system in place, or you would operate HR for the restaurant. How does it work?
All operators, in my opinion, have certain key functions, which again is the finance, analytics, data management, operations, HR, marketing, and branding. Also, too, every single team has unbelievable strengths. But what we're asking independent operators, until you get to that point where you have a corporate office and you're able to outsource or you're able to centralize those resources, you're asking all of them to do all of that all the time. And the reality is that the chef owner becomes the CFO, CMO, janitor, food runner all at once. So what our responsibility is really to come in and help them really patch their potential blind spots they have, build their infrastructure for growth, and then train up their team. So where we look at is we can be either be a retainer where we're working with a client for years and we're on it. We are your marketing department, we are your HR department, whatever that may be, or we do a project fee and we sit there and say, okay, we're with you for 3 months, 6 months, 9 months, 12 months, and we're going to build this out for you. And we're going to train your team up and you're going to be self sufficient. And we're not only that, we're going to help you hire. Because to me, both of those scenarios are truly success for us. It's like as much as we should make ourselves, particularly on the project side, obsolete over time and offboard ourselves and let them be sufficient and they can call us anytime. And then we help the next operator build growth and for stability. And that's where the idea always came from. The name itself, Oyster Sunday, means operating system. That's where the OS came from, which then spun to our second company, which is OS Benefits.
Fascinating, because it is. I speak to so many chefs who are like, where do I get the business knowledge? I can julienne a carrot. I've done 4 years of culinary degree. I can work with liquid nitrogen and I can do all of this great stuff in the kitchen. I can make you a chocolate image of yourself. I can do anything in the kitchen. I was speaking to another chef recently who was like, where do I get my 10,000 hours? The Malcolm Gladwell 10,000 hours of business knowledge.
Heard, chef.
Chef Heard.
Thanks for listening to Heard, the podcast that aims to put the rest in restaurants. This episode is sponsored thanks to San Pellegrino and Accor, two brands that care passionately about the restaurant industry.
Heard, yeah, I got that. Don't worry.
Talk me through the inception of OS Benefits. Why did you create it? What was the story? Where was the inspiration? How did it strike you down? What does that look like?
Yeah, I had written the business plan for Oyster Sunday back in 2012, sat on it for 7 years, feels like I don't know any of this information. I had not met the people to build this with me, sat on it, and then finally in 2019 put it into motion. And at the time, I knew that a big Achilles heel for the industry was not having access to healthcare. So naively, I was like, oh, well, why don't all of our operators just come on our healthcare plan and then we have another value prop for them? And needless to say, the American healthcare system does not allow such things unless I own 51% of all the businesses. And so I was like, okay, well, that's not going to work. And so I just started over about 3 years ticking away at this idea and not letting it go. And instead, what we ended up doing was building what we call a fringe benefit platform. Fringe benefits are nice to haves. If your employer gives you gym memberships and transit memberships and all these other perks and amenities, I would say more perks. So we started there. We said, okay, why don't we build a platform that provides perks for all these operators that's still a value? And so we went after telehealth, dog walking, childcare, like continuing education courses, culinary tools and apparel to do this and say, "Hey, is there traction here?" So we started with that and rolled out our first version of it in 2021. And September 23 launched the new fringe benefits. But at the same time, I'm still ticking away at trying to get healthcare, true medical healthcare.
Is Fringe more accessible to start with because it falls under less regulation than healthcare?
Totally. Yeah, exactly. So, for example, there's so many brands out there. Let's use ClassPass, for example, that have corporate memberships. So your employer buys you a gym membership and you're able to go and use the gym for a subsidized rate by the employer. That's what it is. And it happens all the time. I feel like the Googles and Airbnbs of the world have always set a great precedent of all these perks that their team gets. That's what that was meant to be. And so we were able to broker over 25 vendors onto our dashboard, made it free for our employees and our clients and their employees, and then started going off to the races. Simultaneously, we also were looking at healthcare the whole time. We knew that there had to be a way, and maybe it's ignorance or grit that allowed us to get here, but we just pushed and pushed and pushed. I talked to every carrier, I talked to every insurance company, brokers, try to figure out how can we tap into this market because there has to be a way through. And in May of 24, we were able to broker and to secure 4 ACA compliant healthcare plans. These are really unique, and I kind of want to distinguish given what we talked about in the beginning around small business health insurance and you're in this little cycle, this catch 22 cycle that you find yourself in for the big five, the United Healthcare's, Aetna's, Blue Cross Blue Shields. What we were able to do is say, okay, what happens if we had plans that met the needs of our population and we were able to broker them as part of an association? So we established an association, we established a trust, and we were able to then broker these relationships with this insurance carrier to come on board. That includes medical, dental, and vision, and prescriptions for all that jazz are all part of it. So the employer is able to bring their team on as part of the association. It's shelf stable costing, so there's no variability of age. The only variability is 3 states, which is New York, Connecticut, and California, are about $40 more because of those state restrictions. And it's almost like buying it off Amazon. You have a head count, you have a shelf stable cost of your premiums, and your team enrolls, and we onboard them within days, and they're off to the races. So we're able to truly insure people.
This is amazing. This must have felt great.
Thank you.
This must have felt great when you were like, "We've cracked it. We found
Yeah.
the way in." Because you just reminded me, and sometimes I forget, even though this is specifically about America, this podcast, you then have the state laws to play with.
Oh my goodness, yeah.
It's not countrywide specific. It's state by state, which makes it even more complicated to broker something like this. How did it feel when you cracked the code?
First, I think I was like, "No way. Did we?" Like, and then I think I cried out of pure joy because I had sunk so many hours and so much time into this. I was like, "I will not give up. I will make this work. We'll figure it out. There has to be a way." And so it's very exciting. We've been very fortunate since May to have operators across the country already join. We've gotten exceptional feedback from them about how to improve the product, and we have a whole new enrollment process that's rolling out and a whole new dashboard for the employees that's starting Q1. It's really high function. We were listening to feedback loops time and time again for these early adopters that came in, and that I'm super grateful for. We learned so much, and I'm really excited that the team's onboarded. We've just finished our pre-seed fundraise and have exceptional investors on board that are social impact focused and very much brand aligned for us. And the team is growing and couldn't be more excited.
Let's prep. Let's go.
Heard, chef.
Chef Heard.
I got this.
What are the costs to this? I'm an independent restaurant. Let's say I've got 20 employees and I'm looking to do this. What's it going to cost me, Elizabeth?
So what you'll do is you'll join our association, an annual fee you can pay monthly. And on a monthly basis with 20 employees, we're talking $150 a month to join.
For all 20. Wow.
Everyone, $150 as the employer you join, regardless of your employees get healthcare. They can opt in or not opt in. Regardless, everyone has the fringe benefits, our wellness marketplace for free. So all of your operators, all of your team can come in and utilize that. For the employees that choose to opt into healthcare, we have our essential plan, which is medical, including primary care, specialty, formularies for your prescriptions, $5 generics, and then what we call hospital indemnity. So it's more of a reimbursement. So if you have to go to the hospital, this is really meant for someone who's probably a higher appetite for risk. They don't have any chronic conditions. this is going to protect them for any sort of spill, anything like that. If they're biking, anything were to happen, this is really great for them. And it starts at 239 a month. And as you get up to our what we call our PPOs, which are much more your traditional medical, so this includes hospitalization, we start at 424 a month and go up to 624 a month, depending on the type of coverage and flexibility you want in your plan. To put this in perspective, like most bronze plans in the state of New York will cost an operator about $1,000 to $1,500 premiums for a small business in the big five healthcare plans.
For the worst package for
Yeah,
the
for something that's
basic.
super lean. I wouldn't say the worst, but definitely lean, lean, lean. So kind of bronze and silver. So there's restrictions on your because things you have to consider are not just your premium. You have to consider what is your copay, what is your co-insurance, what are your deductibles. And one thing that we did for all of our plans is that we made sure that the deductible was as low as we could make it. Copays are low. And that's what we knew because it's not just about the premium you're paying every month. It's about when you have to utilize it. What are you out? How much are you out? And we also are working with companies like amazing organizations like Southern Smoke Foundation is one of our vendors on our platform, and they have emergency relief funds, right? So we're trying to create this whole cycle of saying, okay, maybe you are like, you do have to utilize some emergency relief funds because you're still $1,000 out for a deductible you have to pay. So why not build into the system a way to protect you still even further? And on all plans, including the essential plan, it's free mental health and things like that nature that we know address the issues of our population, not just any plan. And so I think that's something that's really unique. And we're really clear too that all of our plans are as robust as possible, given the ability to meet these premium requirements. And we're really clear with operators that if you have people with chronic conditions, we're really mindful of saying, you know what, let's talk because if this may or may not be the best fit for them. And if it's not, let's go find them another plan, right? It's meant to protect 95% of our teams. And there's always people that have other very chronic conditions for specific medications they need to take that we're like, here are the formularies. So I think for us, transparency and being completely upfront so people can make informed decision is our responsibility.
So the cost to the and excuse my ignorance because, I'm in a real socialist country here, like,
You're lucky.
yeah, and, I come from the UK where it truly is free as well, like, you just walk in and you get treated
Yeah.
and there's never a bill. The cost to the employee is just the copay.
So it depends on the contribution of the employer. So let's say,
Okay.
let's stick with the $239 plan. So your employer can say, "Hey, I want to give you 200." And so every month I'm paying $39 my premium. Or they're going to cover it fully. Or maybe they say, "I want to cover $200 of all plans." So as you get a more expensive plan, you pay the difference. That's your premium that comes out of your paycheck. In the plans, then there are copays and deductibles. The
Okay.
deductible is always if you have a total deductible of $5,000, all of your medical bills going towards that will cap at 5K. And then your copay is saying, I want to go see my primary care doctor and I have to pay $15 at the office. As the insurance world since the 1950s and even before that have gotten more complex, there's all these layers of different definitions of what these payments are. And it's amazing having learned a fair bit of what comes out of pocket, even when you're paying $1,500 for a premium, right? So I think the one thing that we do, and we hold ourselves very responsible at OS Benefits, is that we have really big onboarding documents. We even say, like, the jargon of healthcare is complicated. Let's make it simple. And we write it in language that can be understood very quickly so people really understand what the cost of care is.
This is so cool.
Thank you.
No, no, really, this is but are we in a game where the more people that join this association, you can drive the costs down? Am I correct in thinking that?
That is correct. We'll have more negotiating power. We de risk. The bigger thing is that when it comes to annual, and this is actually really important, when it comes to annual premium increase that I alluded to before, and that kind of catch 22, is utilization, small groups. The more you utilize, the more at risk you are as a population. And then your premiums increase. Something that we're hearing, having talked to hundreds of operators about health insurance this year, is that these premiums are going up 18 to 20% for these operators, which is an enormous jump. And so what we're able to do in terms of the costing, we're able to not only de-risk the entire population, but by doing so, the population, if we have more participation, which our participation rate is much higher than industry. Right now we're looking at, it's really great. So that's a big jump. And as we continue to get the cost down and more stable, it's gonna be even more accessible.
A lot of this stuff improves with lobbying efforts. Do you get involved in that? I know you have now the Independent Restaurant Coalition that's trying to do quite a lot. Is this something that you as an organization get involved in as well?
The way I see our responsibility is that we're a conductor, right? We're constantly looking and working with organizations. And I think about this too as with my teams, is that like I'm the conductor and I have the first chair cellist, the violist, and so on and so forth. And it's their responsibility to be the best at what they do. Right. That's what we do at Oyster Sunday. We have this team for that. And then OS Benefits, when I look at the marketplace, is that we're not here to reinvent telehealth. We're not here to reinvent mental health for like behind you with Southern Smoke, but we're here to aggregate them all to understand what's the best of the best, to put them on this platform to make them accessible. That to me is our responsibility. So even when it comes to advocacy, like hopefully in the future when IRC and different organizations are advocating on behalf of the industry, we have a loud platform to amplify that on their behalf to all of our operators, right? To me, that's where we can come into play versus having another organization that's lobbying. I would let them be loudest and for us to then disseminate that information. That's going to be helpful.
What's been achieved here is incredible. It's one of those things where you think, okay, let's get everyone to join together to be able to afford healthcare cooperatively. Simple, right? But as Elizabeth has already explained, it's not that simple. There's this regulatory factors, there's the operating across state boundaries, there's the costs. So many people would have had this idea and failed at the first hurdle. But as you heard, Elizabeth isn't the kind of person to do that. Cracking this code right now is really important to her.
We want people to have care that they deserve in America. And right now, the onus is put on small businesses. And so until that changes, which we don't foresee happening, we think that this product will be more needed than ever. And so our goal is really to be the best benefits administrator for the hospitality industry, because at our core, Oyster Sunday and OS Benefits are operators. We have been in hospitality. We've built this for the hospitality industry by it. And so all of what we're trying to do is really solve a key essential issue in the industry through the use of technology and the collective buying power.
Isn't it interesting how full circle your journey's been?
I know, yeah.
You essentially, you still had that medical bug in a way, but you administered it in a completely innovative angle. It's brilliant.
Yeah, I think it took me years to let go of the medical side. I mean, first off, I'm a huge nerd. Still love reading about chemistry, and I read the Merck Manual, which is a diagnostic book for fun. It never left me, but I like to blend it this way. For me, it's the intersection, as you're mentioning, Ryan, is like the intersection of hospitality and healthcare. And I think to me, that's where my life was always meant to go. I feel very fortunate to have built this, and it's not just me, it's like takes the team. We're very lean, and also there's 3 of us right now, and we're about to expand, double and triple the team. So all of this has been built with 3 people, which is pretty amazing. And also the support of Oyster Sunday.
Unbelievable. Yeah.
Yeah, so but I think we've been ticking at it and just being diligent about building what needs to happen first, and have a sense of brand and have a sense of technology, and then putting together the right team to make it all come to life. But yeah, we'd love to talk to anyone who's interested in learning more, even if it's just shopping around as you get into open enrollment. Like we're here to talk to anyone to even help educate as much as we can, because I think people can have professional careers in hospitality, but we have to be willing and able to give that foundation of health insurance as part of compensation packages. And we work all the time with tiering out benefits, being like, what can you do now? What can you do in 5 years? What can you do in 10 years? Because you don't have to roll it all out at once. But I think medical insurance particularly is one that should be rolled out ASAP.
I think it's obvious that I'm very impressed with what Elizabeth has achieved here. And listen, I'm not being completely starry-eyed about this. I know that some restaurants still can't afford it. And maybe, as one of those who gets to sit on the consumption side of the table, should I expect to pay more for the food I eat? With food costs rising so much at the moment, rents, utilities, staffing, and the pressure for restaurants to provide better environments for their staff, at least some of this burden will have to fall on customers. Saying all this, what Elizabeth has done is a significant move forward for the industry. And if you want to speak with her team and understand how you can implement healthcare in your restaurant, please visit osbenefits.co. That's osbenefits.co. You've been listening to Heard, the podcast that aims to put the rest in restaurants. Heard was hosted and produced by me, Ryan King, and produced by Helen Brown. This episode is sponsored by San Pellegrino and Accor, two brands that care passionately about the restaurant industry. Next time on Heard, what impact is food media having on kitchen culture?
It romanticizes it and glorifies it. This trope of the passionate, crazy, angry, violent chef, it persists.
Remember, if you need any mental health support or you just want to sit down and have a chat with somebody about any of the issues we discuss in this series, please visit southernsmoke.org, a great 501c3 that runs free mental health programs for people who work in the US restaurant industry. I'll be back in a couple of weeks with more advice and insights from experts who can help the culinary community with inspiring, informative ideas. Please rate, review, and follow to spread the word about Heard.